ऑडियो बंद है, हाँ जी। All right, so good evening friends, good evening. This is Dr. Kashish Grover, your PSM faculty. So we are going to discuss some of the important questions, some of the important points related to your exam, related to your INICET exam. Guys, are we ready? Are we good to go? Guys, are we good to go? Can we go ahead? Everyone there? All right, so good evening bachcho, good evening everyone. So my question is, you attempted the paper, आपने ऐप पे क्विज दिया. I am sure you must have given the test on the app. I am sure you must have given test. Now audio interrupting, Himali is saying audio interrupting. Dear team member, can you please check? Students are saying audio interrupting. Dear team member, can you please check the audio? All right, without any delay, let's start it. So first question is from the topic rabies. From the topic rabies. Guys, rabies is very important topic, right? Rabies is very important topic. Animal bite, and these are very important topics. Now they are saying that there is a 10-year-old child with presence 2 hours after bitten by a pet dog. All right, so here the history says that the age is 10 years and bitten by pet dog. As per history, dog is fully vaccinated. So a pet dog, fully vaccinated, and the age of child is 10 years. What is the best post exposure prophylaxis? So I want to tell you that this is a case of category 3 bite. Why this is a category 3 bite? Because in history bleeding is given. So when bleeding is given, category 3 is there. So this is a category 3 bite, but the problem here is pet dog who is vaccinated, who is fully vaccinated, right? I want to tell you that it doesn't matter whether it is a pet dog or the animal is fully vaccinated. We do not consider, see, vaccinating animal is a very good thing, but it does not matter whether the dog is fully vaccinated or a stray dog. We still give the category 3 treatment, that is wound wash, that is immunoglobulins, and vaccine. Now quickly I will be revising. Okay, how many types of you have to write in the chat box. Kids, you have to write in the chat box. How many types of immunoglobulins are there? One is equine, another is human. Equine and human. Quickly, dose of equine immunoglobulin 14 to give maximum dose at wound site. What is your answer? Maximum dose, guys, maximum dose, quickly. Maximum dose at wound site. Maximum dose is given at wound site, right? Maximum dose is given at wound site. Is it fine now? It's fine at my end, bacho. It's fine at my end. Do I need to refresh? Rejoin, please rejoin. It's fine at my end. Internet connection is good at my end. All right, so these are the important points. Okay, now coming to vaccine, guys. Vaccine is of 2 types. Okay, I'm sorry, not 2 types, 2 routes. One route is intradermal, another is intramuscular. Intradermal route, yes, intradermal route, guys, quickly, intradermal route. 0, 3, 7, 28. Intramuscular 0, 3, 7, 14, 28. Right? Now, I have a question to all of you. INICET 5-star question. And my question is, among these two, which one you will prefer in a immunocompromised? So you have a immunocompromised case. Both. Guys, quickly, I want to see fire in the chat box. So I will not take your much time. Exam is very near. Quickly, we will revise some important points. Again, those who are new here, this is Dr. Kashish Grover, your PSM faculty at DAMS, right? Very good, Dr. MS, very good, bache. So this is preferred in immunocompromised. This is preferred in immunocompromised. Very good, bacho, very good, everyone. Very good. Now, sorted? Okay. Now, one more point in rabies I want to tell you, and that is re-exposure prophylaxis. This was a matter of controversy few days ago. Re-exposure. So whenever there is a re-exposure, if it is less than 3 months, only wash the wound. If it is more than 3 months, 2 doses are given. 2 doses are given. 0, 3. 2 doses are given. Immunoglobulin not given. Immunoglobulin not given. So this is a different thing, right? Sorted? Very good. Now coming to next question. Oh my god, such a huge question. Such a huge question. Okay, let's read it. A primary health center nurse wants to reuse partially used vial of pentavalent. Quickly, guys, how I am going to take this session, it will be more like a viva of thing, right? Viva thing, like I will ask you question in question. So in one question, we will be discussing multiple questions. So first of all, you have to tell me the policy which is telling you to reuse a partially used vial. Quickly in the chat box, I want chat box in fire. Can I see? Okay, let me ask you. Can I see some fire in the chat box? Can I see some fire in the chat box? Some happy faces in the chat box. Can I see some fire in the chat box? So this is known as open vial policy. The name of policy is open vial policy. Now, scenario is given. The vial was previously opened under aseptic conditions and stored. So this is correct. This is correct. Next, the date and time of opening must be mentioned. This is also correct. The vaccine must be a lyophilized vaccine. Okay, so lyophilized means so basically it is a dried vaccine, freeze dried vaccine, right? It is a freeze dried vaccine. VVM in usable stage means it is stage 1 and 2. Vaccine must not be expired. This is also correct. The vial can be used up to 7 days regardless of storage. No, the vial cannot be used for 7 days regardless of exposure. No, this is not true. So option number 1 here, it is true. Option number 2 here, this is also true. Option number 3 is not correct, because for freeze dried vaccines we do not reuse them, like MR, BCG, BCG and MR we do not reuse, right? 4, is it in usable stage? Correct. Vaccine must not be expired. Correct. The vial can be used up to 7 days. This is not correct. So 1, 2, 4, 5. This is correct. This is the correct answer. 1, 2, 4, 5 is the correct answer. Now, so students, open vial policy. Once a vaccine is opened, you can use up to 28 days. You can use up to 28 days, right? This is not for lyophilized vaccines like freeze-dried, BCG, MR. They should not be used after 4 hours of reconstitution, right? All right, good. Now, coming to vaccine vial monitor. Let us quickly revise vaccine vial monitor. So this vaccine vial monitor, it helps us in it tells you about the cold chain temperature, right? Basically it tells about heat exposure. It has inner square, outer circle. The inner square is basically the chemical and the outer circle is for comparison. Many students think that if VVM is not in good state, it is telling you expiry. No, not at all. VVM does not tell you about expiry. It only tells you about heat exposure. It only tells you about heat exposure. So this is the VVM, inner square, right? When they both are at same color, right? So this is the discard point. So basically what is happening, there is a chemical in the square. Whenever the heat rises, the temperature increases. The temperature of this chemical increases. This is vaccine vial monitor. Quickly, can you tell me about the site of VVM? Cap and vial. What is the importance when the VVM is on the vial and when it is on the top? Guys, quickly, I'm waiting for your answer. When it is on the vial, it means it follow open vial policy. When it is on the cap, it does not follow open vial policy. I told you in DVT, in my classes also, cap once open, yes, Dr. MS, very good bache, very good, superb. Cap once opened cannot be reused. Alright, now next is a farmer presents with high grade fever, ischias in the groin and hepatosplenomegaly. What is the apical? Okay, what is this? Hashtag scrub typhus. Hashtag scrub typhus. If I talk about scrub typhus, here the vector is trombiculid mite. So there is a mnemonic, Sun Mary Su. So there is a mnemonic for scrub typhus. Many students find it difficult to learn the rickettsial diseases. Sun means scrub typhus, M means mite, and agent here is Susugamushi. Rickettsia Susugamushi. So Sun Mary Su, scrub typhus, mite and Susugamushi. What are the clinical features? Fever and ishar. Ishar is a black lesion at site of mite. So where the mite is biting, at the site of the bite, there will be a black lesion, एक black crust सा दिखेगा. This is known as ishar. This is known as ishar. Drug of choice, doxy. Drug of choice is doxy. And guys, I want to tell you that if there is a sign of pneumonia, this is a INICET PYQ. In that question they gave, if there is a sign of pneumonia with doxycycline, there is a sign of pneumonia with scrub typhus. In that case, you can give doxy plus azithro. Doxy plus azithro. But yes, doxy is the drug of choice. Doxy is given initially, right? Now, a new screening test for prostate cancer detect 2 years earlier than the old test, but the overall survival. All right, what is the answer here? But what is the answer here? Any guess about the answer here? Hanji bacho, what is the answer here? What is the answer here? Himali, yes, national drug. National drug, good. Lead time bias. Okay, I will tell you, this is lead time bias. This topic is lead time bias. And I love to teach this topic with example. Guys, suppose there is one lady. In 2005, she developed cancer. And in 2015, she was diagnosed. And in 2020 she died. So sir, there is disturbance in your mic. Okay, Rishabh, may I know what is happening? So much sound is coming or what? Okay, should I stop and restart it? Rishabh, is it bearable or too much? Should I stop and restart? Wait a minute. Himali, yes, national drug. National drug. Okay. Now, bacho. So this lady developed cancer in 2005. She came with a lump in 2015 and she died in 2020. Similar second lady, another woman, she developed cancer in 2005. They both are, suppose they both are linked, they both are twins. Everything is same. Everything is same in these two cases. Just a fact that when she developed in 2005, she started developing cancer, and in 2010 we did a screening program in the community and we find that there is a cancer in her, right? And she also died in 2020. She also died in 2020, right? Now, how many years she lived? In the case where we did not do any screening, in this case the lady died after 5 years, and when we did screening, this lady died after 10 years. Now the researchers are thinking that these extra 5 years are because of screening. This is known as lead time bias. This is known as lead time bias. It means screening is confused with prolonged survival. Screening is confused with prolonged survival. Okay, Dr. Rishabh, let me check. Dr. Rishabh, just wait a minute and let me check it. Okay, I have done some noise cancellation in my mic. I hope it's better now. Alright, so this is lead time bias. Now coming to HIV positive pregnant women diagnosed at 8 weeks. What is the correct ART approach? So guys, HIV in pregnancy. HIV in pregnancy. In this case, the ART of choice is TLD. But the problem here is this dolutegravir is associated with neural tube defect. Now, as per risk benefit ratio, dolutegravir is given. No, it means after screening, even after screening, there is no, the patient died at the same time. They died at the same time, right? So that is why the best answer here is start TLD. Wait till second trimester, not an option. We start it ASAP. We do not wait, we start ASAP. Avoid dolutegravir, no, not avoided. This is true that it is associated with neural tube defect. Start ART postpartum, this is not true. Right? Okay, one last option I want to ask you. So you have started ASAP, but now after delivery, will you stop? Yes guys, will you stop after delivery? Will you stop ART? No, even after delivery you continue, and this is for lifelong. Yes, there is one person named N in the chat box. My reply to you is in HIV and TB both, even in COVID, HIV, TB, COVID. Breastfeeding is not a contraindication. We do not stop mother to feed. All right, coming to next one. This is a $1 million question, and this is something which I get every day. Every day students ask me this, right? Every day students ask me this. So this is topic NLEP, and this topic right. So NLEP, guys, for this NLEP I want to teach you the whole program very quickly. This is very important, and from last 3 years this is a very hot cake, right? Now, so the question goes like this: NLEP. There are basically 3 objectives of NLEP. Number 1, eliminate leprosy. Number 2, strengthen DPMR, and end stigma. For stigma, we have 2 things: Sparsh awareness campaign and Sapna mascot. NEET 24. This was asked last year. I was keep on repeating NLEP is important, NLEP is important. Some believed and some did not. And yes, Sapna was there in the question, right? Then to strengthen DPMR, we have 2 options, right? We do 2 things: MCR footwear, microcellulose rubber footwear, reconstructive surgery. For this reconstructive surgery, we give 12,000 rupees. 8,000 earlier. Bache, leprosy is already eliminated. Leprosy is already eliminated. It is eradicate. NLEP, National Leprosy Eradication Program. We need to eradicate it because leprosy is one. There is a list of diseases which India eliminated, and leprosy is one of them. Now, if we eliminate, you are talking about this. Because in many areas, in many districts. So what was the criteria to eliminate? Less than 1 per 1,000. Less than 1 per 10,000, right? Now, for this purpose, we have ASHA based surveillance. And in that surveillance, if ASHA brings case before disability and or after disability, if ASHA brings before disability, she will get rupees 250, and if she brings after disability, she gets 200. Now, if the person completes treatment and if it is a possibacillary, ASHA gets 400. If it is a multibacillary, she gets 600, right? Now, this is all about NLEP. I have just given you whole concept, whole crux in one page, right? Now, coming back to the question. Now, this is an integrated question. 40-year ASHA 2 hypopigmented patch and 1 thickened nerve with no disability. So it means she brought the case before disability. That means she is entitled for rupees 250. Now rule out the options where 200 is given. Now one thick nerve means this is a case of multibacillary according to the update. Earlier one nerve possibacillary, more than one multibacillary, but now 0 nerve possibacillary, 1 or more than multibacillary. Understood? That is why here the correct answer is A or C, guys. Yes, very good bachcho. Many students, they have given correct answer. This is A. This is A. Good bachcho. This is important. I repeat, this is important. I repeat, this is important, right? This is very important. For detailed video, you can check my back to basic. This is just a crux of the information. Leprosy NLEP, you can go and check my back to basic for a detailed, right? Now, median survival with gene B expression. Guys, median survival means 50%, right? So, somewhere around 2 years is gene B. So, this is known as Kaplan-Meier curve, and it tells about event-based survival. It tells us about event-based survival. No, bachcho, why you are writing A? It is not A. It is 2 years. The correct answer is B. The correct answer is B. It tells us about event-based survival. Now, coming to this one. Randomized controlled trial evaluating in a patient treatment group. Okay, for that we need some formulas, right? Okay, what is the relative risk? Let us quickly revise all formulas in epidemiology. Exposed divided by incidence non-exposed. What is attributable risk? Incidence exposed minus incidence non-exposed. In Indian books, it is given incidence exposed minus incidence non-exposed divided by incidence exposed into 100. Majority of the Indian books, they write the formula this, but all the international books, they write the formula this. In the international books, attributable rate, proportional attributable risk is given, which in Indian books is given as attributable risk. Now, coming to relative risk reduction, it is 1 minus relative risk. 1 minus relative risk. Now, what is absolute risk reduction? Absolute risk reduction. Incidence non-exposed minus incidence exposed, right? So basically this is when exposure is protective. Right? When exposure is protective, we use absolute risk reduction. Now coming to number needed to treat, number needed to harm. Number needed to treat is 1 divided by absolute risk reduction, or in other words you can say 1 divided by incidence non-exposed minus incidence exposed, or in other words you can say 1 divided by control event rate minus experimental event rate. Right? Experimental event rate. Now number needed to harm, 1 divided by attributable risk, or in other words IE minus incidence non-exposed. So this is the list of formulas related to, okay, one is left, very easy, odds ratio AD by BC, odds ratio AD by BC. Right? Now coming back to the question, in treatment group it is 2%. In treatment group, so basically incidence exposed is 2%, incidence non-exposed is 6%, right? Let us convert in 0.2, 0.02. It is 0.06, Now they are asking you to calculate number needed to treat. Number needed to treat is 1 upon incidence non-exposed minus incidence exposed, and it is like 0.06 minus 0.02. After solving you will get 0.04, right? Now 1 divided by 0.04, the answer will be 25. So here the correct answer is 25, right? Very good. Good bachcho. Important question. See, what is your answer? I am sure many students, they marked it correct. Whether you attended my class or you attended Dr. Siddharth Mishra's class, and I'm sure you marked it correct. Dr. Siddharth Mishra, wonderful teacher. Anyone? What you marked? Okay, so what is happening here? A group of 150 people attended a wedding. Within 24 hours, 90 guests developed vomiting after consuming cream-based pastries. The outbreak, a sharp rise and a fall over a short period. Point source epidemic. Very good. Superb, bachcho. Superb. Now, this is a case of food poisoning. In case of food poisoning, there is sudden increase and sudden fall. Is there any secondary wave? No secondary wave. And continuous common source. There is sudden increase in number of cases, but again there is a second exposure and third exposure, right? Yes, this is secondary wave. Now the source is common. So one thing is common here, they both have a common source. They also have a common source. But one thing which is uncommon between two, this is single exposure. This is multiple exposure. Right? And this is also known as point source. Actually, point source means only common source, right? Common source, point source is the same thing. Good. Now coming to the next one. Trapper. Hashtag trapper. Okay, be honest. How many of you marked it correct? Be honest. How many of you marked it correct? From my end, this is a trapper. Actually, it is not a trapper. Somewhere deep down, somewhere I believe someday there will be a question on this topic in INICET, because there is a pattern which I have seen in my career from last 7 to 8 years. The EPID and biostats, the questions which are important in USMLE, today or tomorrow, they are there in your INICET exam. And this is a very important concept in USMLE. Very important. Got trapped, marked wrong, primary. Okay, no one who marked correct here. No one. Saurabh. Because in my every class and back to basic, I talk about this topic and I tell you that this is, I have a gut feeling that someday this will be in your INICET exam, right? So the answer here is quaternary prevention. The answer here is quaternary prevention. So quaternary prevention means preventing over treatment or over diagnosis. Now I tell this topic as a story in my classes. What happened during COVID second wave? I got a call from a distant relative that the parents are a distant relative. They called me and they said that their parents are in ICU with moderate to severe COVID, and kids are also positive for COVID. Mild symptom, nothing much was there. So they asked me what to do. I said, do nothing, just be calm and be in touch with your parents over call. So next day, they forward me a report of CT scan. Absolutely normal report. I said, why you underwent a CT? There was no need. So they were like over diagnosis. They wanted to diagnose it. After 5-7 days, again she had a CT, and again she forwarded me the report, and again it was normal. So twice she went through HRCT chest, right? What was happening here? She was trying to overdiagnose. She was trying to overdiagnose herself, right? Next example, this is something which you have heard, over treatment. Giving, hydroxychloroquine people were taking, ivermectin people were taking. They were trying to over, and rather than benefit, it was harming. So there is one prevention in USMLE and US. They have 4 level of prevention: primary, secondary, tertiary, and quaternary. Right, the 4th there they teach is quaternary. So this is important. Just one line: quaternary prevention from unnecessary harm. Now, a woman is diagnosed with early stage breast cancer after routine mammogram. Which level of prevention does the screening represent? Yes, what was the answer here? Quite simple: secondary. The answer is secondary. A blood test is developed for early detection if the cutoff is lowered. So guys, if this is an important topic for your INICET exam, right? Now, who are they? They are false positive. This is the cutoff. And who are they? False negative, right? So in this case, if we decrease the cutoff, what will happen? Now, but in this case, many students are saying B, sensitivity. No, this is not correct. So what is happening here? Here, if I decrease the cutoff, false positive is going to increase. False negative will decrease. If false negative decreases, sensitivity increases. If false positive increases, specificity decreases. So correct answer is C. Sensitivity increase, specificity decrease. HDI. This is a bread and butter question. Very, very important. And we know the mnemonic: hey, don't kill at birth. K stands for knowledge. I stands for income. And life expectancy at birth. Literacy rate is not there. Knowledge, we have mean year of schooling, and we have expected year of schooling. So mean year of schooling, expected year of schooling, life expectancy at birth, income. Alright, again, trapper. Was it a trapper? Woman dies from cervical cancer, life expectancy 80 years, but she dies at 25. Primary contributor to her Dali. Trapper. No, not a trapper. Not a trapper. Guys, what was the correct answer? Years lived with disability, years of life lost, both YLD and YLL. Quickly. Quickly, guys, quickly. Trapped. Very good. So in this question there are no disability. No disability is given, but she died almost, right, 55 years early. So it means 55 Dali was contribute. So what is the Dali? YLD plus YLL. YLD is 0 because no disability here, and 55 years she lost to early life. So here 55 years she lost, which equals to 55 Dali. So here the correct answer to this trapper is year of life lost. Year of life lost, right? A cohort study is conducted to evaluate risk of lung cancer in smokers and non-smokers. Among 1,000 smokers, 50 developed lung cancer. All right. So incidence exposed is 50 divided by 1,000. And while 1,000 non-smokers have 10 cases, what is relative risk? Oh, very easy question. I think this is very easy, right? This is very easy. 50 divided by 1,000 divided by 10 divided by 1,000. If you solve, the answer will be 5. Oh, it's marked here. It's marked here in the work, in the question it is marked. Guys, thank you so much. This was your questions for Predictor, and I want to tell you that do not forget these topics. Half of the PSM in Predictor series is already done with Dr. Siddharth Mishra. You guys have done, right? And this portion, if I talk about, study designs are ultra important. HIV, TB, and your rickettsial diseases, very important for your INICET, right? Very, very important for your INICET. Study designs are very important. Calculations are important. Level of prevention is important. Rabies is important. But this thing I am not very much sure about, right? Yes, ASHA based survey. Leprosy overall is important, right? Leprosy overall is important. And with this, I thank you so much. If you have any doubt, you can connect with me, right? You can connect with me. Keep studying. बच्चों पढ़ते रहो, है ना? पढ़ते रहो. Have faith, right? Have faith. और एक चीज़ मैं बोलना चाहूँगा, अभी क्या ना, पिछले 2 दिन से we are getting messages. I am getting messages. Sir, I'm not able to study. I'm not able to study because so much negativity and so much worry is there outside. I'm not able to study, right? So guys, I do understand this is a tough time, but I request you to, you know, maintain that calmness and keep studying. Just keep studying, right? And focus on your exam. With that note, I want to end here. Thank you so much. God bless you. Keep studying, right? If you have any doubt, you can definitely contact me. This is my Instagram handle and this is my Telegram group. Yes, Dr. Himali, we are going to have a quiz at 10:30, maybe 10:30, not 10, 10:30. Thank you, Dr. Manoj, Dr. Soumya, Dr. Kulkarni Vaishnavi Bache, Dr. Himali, Dr. Ishika, Dr. Rizwan, Dr. MS. What is your name? MS. For me, you are MS. Okay. MS OBG. All right. Thank you so much. God bless you. Bye bye. Take care.